All right. So is everyone seeing those slides? Okay. So what I would like to do is, first of all, just go over the brief schedule. And before I even do that, I should introduce myself. For those of you I haven't had the pleasure of meeting, I'm Julia Microaggressions, and I'm our current WSPA president. I'm going to have the rest of the board introduce themselves as well. So my plan for today is we're going to start off just by having every member who's on here get a chance to know who the board members are. Then we're going to do introductions for everyone on the call when we do breakout rooms. I'm going to get to that in 1 second. So from 10 to 10:25 this morning, welcome introductions. And then what I want to do is give you an overview of what WSPA has been up to this year so far, related both to the pandemic and anti-racism. Then what will happen is we'll split into 2 groups. I'm going to note that that's an artificial division. You know, I think a great example of where the pandemic and anti-racism align actually uncomfortably well are things like health disparities in not only who's exposed to the virus, who gets it, who has mortality from it. And one of the things that the board and I discussed is to do both issues justice. I think they each need separate attention, even if that means we come back together and look at the ways that they overlap as well. So please don't take the discussion to mean that we think these are separate issues. I think very much that they are not. And we were trying to figure out how can we also give the various aspects of each the attention they deserve. So what you will see, and actually Sierra may do this in a minute as I'm talking about it, is at some point before 10:25, you'll see a poll asking you which part of those individual discussions do you feel a little more drawn to today. So you'll be able to choose, do I want to be in a pandemic-focused discussion on where are we going with that next? Do I want to be in an anti-racism discussion? And then at 10:25, we'll take a little break just because this is, you know, a Saturday morning and why not? And when we come back, we'll have those 2, including CEs. So if you do have questions for them for how do I do the poll, what do I do, feel free to utilize the chat. So from 10:35 to 11:15, so 40 minutes, we're going to focus some discussion on where do we go from here. We know what we've done so far this year, and then we'll finish off the meeting by coming back for a full group summary of what folks on both halves of the discussion talked about and where to go next. So that is my plan for this morning. And anyone who just came in the last couple minutes, I will say this again, welcome. So definitely when we were talking about this as a board, the thought crossed my mind of, oh my gosh, we could put out this call for a town hall and then no one could come. However, that's clearly not the case. So just please know on behalf of myself and our staff and the trustees, we really do appreciate that you're willing to show up on a Saturday morning to talk about these things with us. So I'm so glad to see everyone who's here. So what I will say is we'll just do brief little introductions next before we get into the kind of what have we done. So as I said, I'm Julia Microaggressions. I am our current president. I'm located in Spokane. When I'm not doing WSPA things, I work at the VA here. So I will one of the other board members continue on these introductions.
Good morning, everyone. I'm Dominique Breedlove. I've been with WSPA on the board for about 3 years, and I am past president as of last year. Those of you who join in late, I do not have purple hair, although I'm wondering if that's what happens to past presidents, so Julia, watch out. And outside of WSPA, I practice in integrated primary care, Wenatchee, Leavenworth area, and also have an internship program, so I'm a director of clinical training.
Dave, I'm going to call on you. Is that okay?
Okay, sure. Yeah, I wasn't sure if I should go or not. Hello, everyone. I'm Dave Webster. I'm your WSPA president-elect. I'm relatively new to the state here. I've been here a couple years and been on the Board of Trustees 1 year. I'm in a group practice in Redmond.
Thank you. I'm gonna, so board members, be aware, I'm gonna call you all out. Casey, would you introduce yourself?
Hi, I'm Casey Ward. I live in Olympia, Washington. Been a board, I think this is my second or third year on the board. And because I live in Olympia, one of the things that I was passionate about was the legislative advocacy portion. And so if any of you are interested in that, we would love to have more folks to join our little band of advocates, especially as we come up to a very, I think, critical kind of sessions, even the ones that are the special sessions that may come up for funding and those kinds of things. So we've really been trying to get a handle and be more active along that lines. I was in education for 27 years, been in private practice for 11. I'm working out of my home like a lot of us are right now. And so welcome to the town meeting. I'm so glad you're all here.
Thanks, Casey.
Sure.
Shelley, can I call on you next?
Sure. Hi, I'm Shelley Mackman, and I have a private practice in Redmond, and I work in an integrated primary care clinic in Kirkland as well. I'm probably 2.5 years on the board, and also work with our PAC, United Political Action Committee for Psychologists, so you probably get emails from me from time to time. So happy to be here.
Thank you. Okay, and then we have our newest addition to the board. Linda, would you introduce yourself?
Of course. Good morning. I'm in Seattle, Washington. I am the newest board member. I have been on the board for, I think, maybe since March or April. So I'm learning the ropes here. I'm in private practice and I do behavior management therapy with the young kiddos. And I'm interested in more the diversity, equity components of Washington as a state. And I am so glad to see everybody this morning.
Okay, and then actually, Russ, you're here too. And would you mind saying a quick hello as well? My video is adjusted, so I can't see Russ.
Ross, you're muted if you're trying to talk. That's why we can't hear you.
Is that better now?
Yep.
I'm so sorry. Anyway, I am treasurer and have been, was for several years, and then took a break while Julia came on and did amazing things. And I'm back for a year, and I'm looking forward to hearing what's going on today, and appreciate the people putting this together.
I will say the one board of trustees, oops, I didn't mean to advance there. The one person we're missing today who is definitely here in spirit is Debbie Shapiro. You've certainly gotten emails from her. She is our Disaster Relief Network chair. And as we go through these slides, you will see she has done just a phenomenal volume of work this year related to the pandemic. She couldn't be here because of an unexpected family obligation, but sent lots of messages helping us sort of, I think, honestly do justice to all the stuff that she's done, but also she would definitely, she's happy to follow up with anyone who is going to be interested in learning more. So some of the, actually not some, the huge majority of our pandemic response would not have happened without Debbie's enormous expertise and dedication in this area. So she's definitely here kind of in spirit. Okay, so what we'd like to do today with you all is what we were talking about as a board is, you know, 2020 has really been extraordinary in a number of ways. I think related to the pandemic, one of the things that I'm sure a lot of us have been talking about with our colleagues is that we are helping our patients navigate a global pandemic while also living through the global pandemic ourselves, which is pretty different often, you know, than our own closeness to the clinical material being presented. And then on top of that, I certainly, please don't get the impression that the board thinks anything going on with racism in America is new. That's definitely not the case. However, I do think there's been a shift in the kind of civil discourse about it that does feel like maybe some change is possible. So what we want to do today is help us all kind of reflect as a group on what has 2020 taught us about what we really value as psychologists in our work. And then we want to know from you all, our members, as an organization, if we were taking actions that aligned with our values, what would they be? And do you have some interest today in joining us in taking those actions? So we're hoping at the end we'll have at least some additional enthusiasm about ways that psychologists can address the challenges facing the people we work with and also the communities we live in. So that's our plan. So I want to talk about some general guidelines before we go to the overview. This is a lot of material to cover. I will get these out to everyone via email afterwards. So if it's moving a little quickly, know that that will happen. Your trustees here today, we take responsibility for having a respectful and productive conversation. If we get any Zoom bombers, we're going to mute them, so be aware of that. One of the things we want to say is we're having, sorry, was someone saying something? I'll take a look at the chat. Okay. One of the things to know is we hope that you refrain from making assumptions about other participants' race, ethnicity, health, abilities, etc. That's a good rule always. I think it applies especially when we're all meeting on video. And the other thing that we want to put out as a guideline is, to the degree to which we're able, which is going to be necessarily imperfect, hope that people can avoid making microaggressions, which Dr. Daryl Sue defines as the everyday slights, indignities, put-downs, and insults that people of color, women, LGBT populations, or those who are marginalized experience in their day-to-day interactions. And this applies both to our pandemic discussion as well as our anti-racism discussion. So for example, we've got some good links on the website, and I'm sure you all have heard of this, that folks who are Asian American are facing a disproportional additional burden of racism when people make comments like calling COVID-19 the Chinese virus, for example. Another example of that on the anti-racist side is if you're to say something like all lives matter when we're talking very specifically about violence that clearly disproportionately impacts Black, Indigenous, and other people of color, that's diminishing an important experience that does need its own time and space to be recognized. So please keep those in mind. And again, what we're talking about here is nothing about racism is new to the folks who have sorry, skipped ahead there by accident. I have a itchy trigger finger here. So racism is nothing new to the people who experience. I do think that white Americans are, many people having a moment of new or heightened consciousness and a desire to be more anti-racist. What we mean by that is supporting anti-racist policy through actions or expressing an anti-racist idea. This includes WSPA. So we're an organization with a majority white membership. So we want to work to be a more anti-racist organization that's more inclusive of psychologists of color, not only in our membership, but also in our leadership. So we're not here to tell you that I think we're doing an awesome job at this, but that we do want to be committed to working on it. Something I think particularly for folks who have a relatively high degree of privilege of one sort of another, I think these kind of conversations can evoke really strong emotional responses. And while emotional processing is often a necessary part of the change process, I'm a psychologist, so of course I think that. I know you all think that. We want to be aware that sometimes emotional responses have been used intentionally or unintentionally in these kind of conversations to sidetrack important conversations about justice for those who have less privilege. So be thoughtful in that. If you do find yourself having strong emotional reactions, that may be something we want to create as an organization. You know, where is there space for folks to do that emotional processing? We're not necessarily intending for that to be today. Okay. So hopefully, feel free to use the chat if you're having strong reactions already to any of those guidelines, but I think probably this group is self-selected to have some interest and facility with these issues. So in our remaining time before we actually get to the discussion part, I do want to walk you through what we've been doing so far this year. And we're going to start with the pandemic. First of all, hopefully you've definitely felt the increase in communication from us. We've been emailing a lot, hopefully not too much with new information as it comes out. And this is the stuff that Debbie Shapiro has really been at the heart of. So the Washington State Department of Health considers us a state level partner for COVID-19 behavioral health response. She meets with Department of Health people weekly to help with things like the behavioral health forecasts you've been seeing. We as an organization are also on the Public Health Reserve 4 Task Force, providing resources and consultation, especially when we think about underserved populations impacted by COVID. And Debbie has also been making connections with APAs, the National Disaster Relief Network, the Red Cross, and other organizations about our behavioral response. So one of her huge strengths as a trustee has been really fostering community connections. Other things we've done so far is we have a big section on our website devoted to COVID-related resources, everything from how to address stigma actually related to COVID to the insurance kind of stuff. One thing you've seen recently is Samantha Slaughter, our Director of Professional Affairs, just brought, I think it was like a 2 or 3 page single-space letter to our examining board with some concerns we have about how COVID is affecting both the practice of psychologists and especially psychologists who are in the process of becoming licensed during this time. We've also done a fair amount to advertise CEs that are particularly related to pandemic or disaster response, like psychological first aid. We had a task force that our trustee Linda did a wonderful job with to create reopening guidelines for when people do have to consider how to do that safely. We created a volunteer effort for UW Medicine that I'm betting some of you were involved in. And you may have already seen the email from Debbie later this week about creating a similar in-house volunteer effort that we could use not only for people willing to provide pro bono pandemic care, but potentially disaster care after that. If you haven't seen that, that's in your email. And also, Sierra, if you would drop a link in the chat to where the survey is on the website. So in this regard, I would say we've been fairly active. And what we're thinking about in terms of steps so far is Debbie's just created a disaster response network listserv. So definitely let us know during the breakout rooms if you'd like to be added to that. We're going to continue having CEs. There's a really interesting one on August 28th. You'll hear more about next week. This is called the Health Support Training, and it's basically helping psychologists identify when you're working with someone who's going back out into their community to provide support just as a layperson, how can we translate some of our psychological skills to extending the support we're providing actually through the people we work with as well. I think that's going to be really cool, led by some Department of Health folks. And you will get definitely continued updates from us about insurance companies, telehealth payment parity. Quick reminder on that. Washington already had telehealth parity. Inslee, I don't know if the right word is backdated. We were supposed to get payment parity starting in 2021. He started it earlier because of the state of the emergency, and we anticipate that will continue. And then, of course, we'll keep you updated about state and federal advocacy regarding making some pandemic policies permanent. Other things we're considering is whether it makes sense to have a peer-to-peer support group related to this. And one of the, again, speaking to how these issues are related, just weaving our COVID programming with our commitment to equity, anti-racism, and psychological resilience, emphasizing the importance of relational and communal attachments. So one of the things I think we're very aware of as psychologists is COVID isn't just something that happens to individual people, but it happens to communities. And there are systemic inequities that have a lot to do with which communities are most affected. So that's definitely something we're being mindful of moving forward. So now I'm going to shift to the kind of related topic of anti-racism. And I forgot to do this earlier, but I want to mention this. For those of you who may have seen the news, John Lewis, who is a congressman, but had an even longer history as a really remarkable activist that our country was lucky to have, he passed away either last night or early this morning. And I think a quote from him really speaks to what we're trying to get at here. So he said, "Speak up, speak out, and get in good trouble. You must find a way to get into good trouble and necessary trouble." And I think that's what we're hoping to do. So some of our anti-racism steps so far this year have been signing on to support things like actually disaggregating the COVID data in our state to be able to look at health disparities. We supported that. We also supported a housing equity initiative that of course affects certain people more than others. We do have, we've made a statement on racial violence, I think about a month ago, and have done a bunch of website related resource collection, not only on stigma related to COVID, but just general resources on anti-racism, talking to children about race and diversity education. The other thing we've done that I want to spend a minute on here is I've been having some conversations with various folks who've been in WSPA leadership over the year to understand we have had diversity efforts in the past, and my question was, as a relatively new member to the organization and as an early career psychologist, I wanted to know more about what wasn't sustainable about that. And I think there's two things. One thing that I'm always happy to speak with members about is we used to have a much larger council that was a little unwieldy at times in terms of size, I think. And now, as you can tell, we have a much smaller 7 to 9 person board. One of the things that created was it created instability in the pipeline from how does a member go from just being a member to getting more involved. And one of the things I think that played out in things like the diversity committee is that and other places where marginalization occurs, we lost some of the pipeline of how do we get good people involved in doing this, able to do the work in our organization. So I think that's one facet, and taking a really clear look at it. I also think that often some of our social justice efforts were championed by a psychologist who had a marginalized part of their identity. So some LGBTQ psychologists were very involved in marriage equality efforts, which I think we should be very proud of as an organization. And I think the onus is on those of us who have privilege in various ways to not have these issues be something that we need someone marginalized to take the lead on. Right? This is truly a project for all of us. So in terms of steps ahead, there's a couple things I want to bring our attention to that we will talk more about in the anti-racism breakout room. We do have the bones for a diversity committee and have had active ones in the past. So I think one actionable step might certainly be seeing if there's folks out there who would like to serve in this capacity. Another possibility, if any of you listening are a numbers person or are a good with fundraising person, our WSPA Foundation actually has a really cool mission. It's to empower vulnerable populations through connection to resources, community building, and creation of partnerships with psychology. So I love that mission. And one of the things we need to think about is how to do that in a sustainable way and where to direct resources. So I think those are both good examples of some structure that we already have in place that we've had trouble making sustainable. So then one of the questions for us is how to do that. Like Casey mentioned, social justice is on our legislative agenda, so I think more legislative advocacy committee is good. And another project we'll talk a little bit about is we want to get better demographic data on our members to assess how we might be contributing to marginalization. We know that psychologists who are Black, Indigenous, or otherwise people of color are underrepresented in our field, and without good membership data, we don't know how, I guess there's a happy possibility we could be bucking that trend, but also we could be doing even worse than we should in terms of representation. So just some sort of research stuff I think is warranted. Other options, we're considering advocating with the Examining Board of Psychology about disparities, particularly related to the licensure and EPPP project. We can talk more about that in the breakout room. A couple folks have mentioned that they'd be interested in doing something like a book club, having some group accountability for continuing their own anti-racism education. And we're also, I'm excited about this, we're collaborating with the Washington State Society for Clinical Social Work on a couple of our CEs and a couple of theirs. So do keep your ears tuned. They have one coming up relatively soon on systemic and structural approaches to anti-racism. And then this book by Dr. Nieto is actually on our resource page. They're having her present on her concepts related to beyond inclusion, beyond empowerment. So please look for some anti-racism and equity related CEs as well. So that's the quick drinking from a fire hose overview of what we've been doing, possible directions to go from ahead. And what I'm going to do is, Sierra, will you let everyone see the poll question if you have not already. And we'll take a short break. Think about which breakout room would you like to be in, and then we will shift into those rooms. The other thing to know about is if you're not familiar with breakout rooms, you will be assigned a breakout room. You don't have to do anything. You'll just get placed in one. Sierra, if I'm describing that correctly or incorrectly, feel free to speak up.
That is correct, yeah.
Okay. So what we will do is we will, I only talked 5 minutes over, which is actually pretty good for me. So if anyone would like to take a 5-minute break, you are welcome to do that. And then when we return, you will be in whichever breakout room that you have opted for. Thank you for the Zoom magic. Also for everyone, I was completely remiss earlier in not giving a moment to introduce our awesome staff here. So Marvo and Sierra, could I have, yeah. Marco Verquinden is our executive director. And Sierra, you've been seeing do tons of behind the scenes magic with Zoom today. She's our office manager, and we're so grateful for both of you.
Magic or chaos, I'm not sure which it was, but I was happy to be a part of it this morning.
Magic chaos, that's what I got out of this. So I would love to hear, since definitely some people mentioned earlier that these two topics are related, would someone, let's do a recap kind of for across the two breakout rooms. Are there any main takeouts from the pandemic breakout room?
Casey, do you want to go ahead and just kind of give us an update? Unmute yourself, please.
I will invite both David and Shelley. We had some great ideas, had some great input on that. David, I think you were taking notes. Do you want to just go over some of the things that that we talked about in the breakout room?
First of all, a lot of the members were really thankful of WSPA in terms of the support information that we sent out to them. There were still some things, kind of practice things, telehealth kinds of information that could be useful to our members to help with the crisis and the practice changes that people are going into. Just information about what kind of telehealth platforms are useful or not useful, what kind of tools, and get some skills in using Zoom or whatever platform you're using that might be useful to members. But there was just a wide variety of ideas from people. We appreciate them. I'm going to kind of pull this all together and kind of share it with the Board of Trustees, but a good discussion this morning.
Great, glad to hear it. Well, so on our end, and anyone from the anti-racism breakout room, feel free to jump in as I summarize. I think my main takeaway from this is that this was just the beginning of a whole bunch of, I think, good trouble for us. And so we had folks everywhere from 2 graduate students who I'm thrilled joined us in that conversation, all the way up to practitioners in their 80s. I think a couple of the things that were highlighted is that folks feel really passionately about this issue and are at various stages of their own understanding and also how involved to be. And we also talked some about how involvement varies across the state. I know everyone from people working on the west side of the state, which I think can be more progressive, and also folks doing really important things, with migrant farm workers, for example, which is a great example of a marginalized population in our community. So I think we are going to be working as an organization on figuring out how to further these conversations, both in the overall sense of where are we going as an organization, but also knowing that we're going to need some specificity in our efforts in order to be effective. We also got some great comments, and I think this is what we're doing better for the pandemic than we are for diversity related issues, of partnering with other organizations. WSPA doesn't have to be everything to every psychologist, and part of our strength may actually be in figuring out how to get people connected to organizations that are already doing great work and supporting that. So I don't know if anyone else who is in that discussion with me wants to chime in or add things.
I'd just like to add something really quickly, Marva. I know I'm hopping in right ahead of you, but I just wanted to emphasize these conversations, particularly about becoming an anti-racist person or, you know, educating yourself. These are really difficult conversations to have, especially with new faces. And, you know, I think these conversations need to happen, and especially now, pandemic with Zoom and all this, it's even more difficult to have, you know, sensitive conversations like this. So I think it's just important that, you know, I speak up and emphasize the fact that oftentimes when we talk about, you know, privilege and racism and all this, it's very difficult to find your own voice. And so I think it's important for me as I'm just quick disclosure, you know, half Puerto Rican and white. And so I pass in a lot of ways. So I just want to use my privilege at the moment to kind of elevate the voices of folks who might be a little timid in, you know, we really are working hard to revitalize our diversity and equity committee. So if you're a little timid and, you know, not sure what to do, everybody's voice is important in this, and really all of our intersectionality is so crucial. So we understand that it's very difficult, but if you're passionate, we want to hear from you. Thank you.
I just wanted to say how proud I am of WSPA holding this town hall today. I participate in a BIPOC, Black Indigenous People of Color Executive Directors Group in the state. And one of the first meetings that they had, the takeaway was, what can you do with your organization to be more anti-racist? And this town hall came up just right after that meeting. So I was really proud that WSPA embraced the idea of doing the town hall. And I'm also starting to get involved a little bit more on APA's EDI, Equity, Diversity, Inclusion group, to see how they're progressing on things. So I just want to say that this has been a really good conversation. I did not sit in on that particular breakout room, but I sat in on the COVID room, and I loved hearing the conversation there. So I'm glad that there was 2 conversations that we could have. And I'm hoping that WSPA, you know, will look at other opportunities to do more town halls and other types of group meetings like this, whether it's educational on how do you use Zoom a little better and things like that. So I think that this is a good start. Julia, I'll just let you end it, or add to somebody else, pass to somebody else.
Well, so first of all, yes, any closing remarks from any of you wonderful participants who we're so glad to have joined us on a Saturday morning?
I would just say thank you, all of you. This was really a delightful hour and a half. I appreciate you, all of you.
Thank you, Kathy.
I would like to see future town hall meetings on both topics, but separately. They're both important. And again, I feel the same way Kathy does. You know, the board, the APA National Board is this sort of nebulous, doesn't have anything to do with me a lot, you know, with where I am in the trenches. And what I liked about this and WSPA's response is it was boots on the ground. Let's do something. Let's not just throw it into a committee. It was really active and proactive. And so again, I feel the same way Kathy does. And I'm very, very proud of our leadership.
Yeah. Speak up, speak out, and get into good trouble.
I will echo Nora. Thank you so much for your leadership. Julia and Marvo and the team. I would be so interested in, you know, if there's ways that we can really utilize the telecommunication platform that we're learning about. I use it every day with my students and have been having Zoom meetings since the end of February when I went into quarantine. And I wonder if we could really leverage this modality to keep in contact. I've been in contact just now with Matt and Marcia in the chat here, and we're already talking about developing partnerships and sharing resources. And I wonder if we could keep up the conversation. Like, I don't know if we could do monthly town halls, but I would love to use this as a way to get to know my colleagues in the field in Washington and work together and more powerfully as an organization.
Yeah.
Well said. I think that is exactly the kind of thing we would love to support. So for follow-up for today, and I think like what the part of what that speaks to is this idea of creating more space in the middle, right? Of as a member, how do you get more involved in ways that are meaningful to you, right? And from the leadership perspective, how do we support the stuff that you all are passionate about? So I don't know that it will be today, because after Saturday's Zoom meeting, I might have to go garden. But at some point soon, please do expect we will be following up with you all with specific kind of asks of based on what you've said you're interested, what would you like to come join us in continuing to do? So please look for that, and we are excited to be doing this work with you all.
Thank you.
Thank you, everybody. Enjoy your
Thanks.
Saturday.
Thank you all.
Thanks for participating.